Hello everyone, welcome to HIM 164. And in this lecture we are going to talk about the query toolkit and about the selection of the appropriate queries when there is a question related to documentation in the medical record. In the course you're going to want to select assignments. In assignments you will, let me click on assignments, make sure I'm there. Okay, and then we're going to select the folder for coding and query assignments. And you'll see that you have a link to the query toolkit. Now I would like to point out to you that this query toolkit is available at the AHIMA website to members. And you are student members. And as long as you're a member of AHIMA, you can log in, go to the body of knowledge, and actually Google search on toolkits, and you will find this query toolkit. And so this is the tool that we are going to be using in this lecture and for your assignments. This document is going to open as a PDF. And as we go through this document, in the instruction portion of the document, there is a link, and it will actually convert this to a Word document for you, so that when you're completing the queries, you have 3 queries that you'll be completing for your assignments, that you can convert this to a Word document and use those queries. And we're actually I've gone past the table of contents into the introduction, when to query, the query process, and you'll notice that we are, let's see if it's going to load for us. We are in the instruction portion, and there is the link right here. So in instructions, which is on page 9, it says you may follow this link to access a Word version of the document. And so if you click on that, it will actually convert it to Word for you. I'm going to leave it in PDF format for this lecture. You do have an assignment that requires that you read through this document and answer specific questions about this document. You'll notice that this document is formatted based on the chapters in ICD-10. That's not to be confused with the chapters in your textbook, but in ICD-10. There is a generic template, and then there are miscellaneous templates, and then there are templates that are specific to those chapters in ICD-10. So for instance, chapter 1 in I-10 is infectious and parasitic diseases, chapter 2 is neoplasms, and so on and so forth. So I'm going to click and go right into the introduction. And one of the reasons that this query guide or query toolkit was created was to provide HIM professionals that are creating queries and clinical documentation improvement professionals that are creating queries with guidelines and templates for the wording. We want to be very cautious when we're generating queries. We don't want to lead a physician. We actually want him to clarify documentation for us. The query process has been around for some time now. It is recognized and supported by Coding Clinic. It is a benefit when we're billing and we're applying coding rules, and it's also can be an educational tool for providers. It makes them aware of where we're having issues with documentation. And of course, CDI professionals, people that are looking at charts while patients are in the hospital on the floor, can usually use these tools to clarify any discrepancies. When to query. Basically, we talked about this in HIM 216. Querying is when we're challenged by the documentation that's in that medical record. These are some of the reasons that we would need to query, and I'm not going to go over all of these with you. We've talked about them before. I'll just, with a cause and effect relationship, if we have an organism and a disease process and a combination code, we really need to have the organism and the disease process linked. And so we would, if we had, for instance, pneumonia and the sputum grew out E. coli, in order to apply the code for E. coli pneumonia, we need the physician to say that the pneumonia is due to the E. coli, and that's a perfect example of when we would use a cause and effect query. And then there can be other issues related to the query process, that we may need to have additional information on. And so those are all opportunities for a query. There are also times when we might find documentation in that health record. We might have abnormal tests. We may see that the physician documents an abnormal value, follows up with a medication, but doesn't actually have a diagnosis to support that. So we may need to query for that process, for that disease process. Now, when we're looking at the query process, queries can be either verbal or they can be written. They can be generated concurrently, meaning the patient's still in the hospital, or they can be generated after the patient's discharged. People who may generate a concurrent query, if you have coders who are concurrently coding the charts of patients while they're in the hospital, it can be a concurrent coder. It could be a clinical documentation improvement person. So someone who's reviewing that chart and determining that we need clarification on documentation. In the retrospective setting, it's typically a coder who is generating a retrospective after discharge query so that they can very accurately code that chart. We can have a written queries, we can email queries. The way that they're handled will depend on the organization that you are in. When we're looking at the query templates, we can edit them, but they suggest that we only delete the part of the query form that's not pertinent to the query. And we can add additional clinical findings that are documented in that medical record. So we don't have to use them exactly as they are. We can edit them as we need to. If we have verbal or queries that are completed over the phone, we would handle those in the same format as we would written queries. And then the queries should be clear, they should be concise, they shouldn't lead the physician, they need to be simple and direct, and they need to use clinical indicator. They need to list those clinical indicators and then from the health record that we're actually questioning the physician about. And the query should include all the patient's identifying information, and that's listed here. And queries need to be logged. We actually need to maintain a log of every query we generate. We need to know who generates it. We need to know what physician it is. We need to know what type of query we are generating. And then we need to also document the result of that query. That information is very important for us from an educational standpoint. For instance, we had a physician who we were consistently querying because he would not document that he had performed an excisional debridement. He'd say that he had performed a debridement using sharps, and the guidelines specifically say that the physician has to document that it's excisional. So we were able to track those and then determine that we were querying him all the time, and of course he was complaining about it, and we actually went to him with the guidelines and showed him what the documentation requirements were per coding clinic, and he did change his documentation practice. So these are the instructions for completing the queries. I'm not going to read all of these to you. If you have any questions or problems with the templates, be sure and let your instructor know. And then this is an example of how to actually modify the documentation, enter the documentation that you're working with. This is actually a generic template. If none of the other templates fit what you're doing, you would want to choose this generic template. So for instance, there is a template for present on admission, but there's not a template for discharge disposition. So if you're trying to determine where the patient actually went at the time of discharge, this might be the template that you would be using. And for when you're creating your templates, your provider could be Dr. Smith, Dr. Jones, whatever would be appropriate for your query. Then we have a miscellaneous template, and this is the template that they recommend that we use if there's any question of whether or not a condition or a diagnosis was present on admission. This is our cause and effect relationship query, and we would complete this, for instance, if we were looking at pneumonia and an organism. And then this is the query for Chapter 1, certain infectious and parasitic diseases. And this query is for a urosepsis clarification. You know that we have to code urosepsis to a UTI. We do not code it to sepsis. So if there is a question of whether or not the patient only had a UTI or was actually septic, then we would generate that query. I'm not going to read all of these to you, but I do want to go down to the query for Chapter 18 and point that query out to you. So in this query for Chapter 18, we're able to identify an opportunity. We can say here that we had an abnormal lab finding, and in identify the opportunity, we would identify that lab finding. We could say hematocrit of 23 was documented in the progress note and on the lab work. And signs and symptoms, we may not have those. We can come in here, we would delete that. Treatment was 2 units of packed red blood cells. Based on the clinical indicators in your judgment, can this diagnosis be further specified? The relationship, present on admission, can an associated, I would choose can an associated diagnosis be documented? And then here I would type anemia, specific type of anemia. I wouldn't put anything else for other explanation of clinical findings. Maybe if they did a post-transfusion hemoglobin and hematocrit, I would list those findings here, or the physician actually could complete this section for an explanation of the clinical finding. So this can be used actually when we have, we can't, if we just have abnormal lab work or we just have an abnormal x-ray, we can't query the physician about a diagnosis. But when we can see that that abnormal finding was addressed and the patient was treated, then we can ask for additional documentation in the form of a query. And this Chapter 18 query is the one that we would use. If you have any questions about this query process, please do contact your instructor. You have an assignment for the query toolkit. Be sure and read the information carefully. And again, if you have questions, please let us know.